tonight. I really appreciate it. Sorry for the delay. My name is Juan Marcano. I have the honor and pleasure of being your ward representative. And tonight, I'm going to start us off with an update from Chancellor Horiuchi with the Havana bid, and then I'm going to give the floor over to our wonderful officers here to give us a brief update on APD business, and then to Deputy Chief Robinette to let us know what's going on with Aurora Fire Rescue. Then we're going to move on to our main presentation, which is going to come from Commissioner Baker. Commissioner Holland, I understand, could not join us tonight, sends his regrets, but he's going to talk to us a little bit about the upcoming Arapahoe the Arapahoe Health Department, I guess. Yeah.
We have a name.
I'm so used to Tri-County Health Department. It's like there's more syllables than that. But and see what kind of impact that will have on the city of Aurora. And then after that, I wanted to give y'all a brief update on a couple of policy initiatives that I actually have coming down the pike that I think y'all will be interested in, and I'd love your feedback on that as well. And then we'll close out with open Q&A. So anything you all want to talk about, I'm here, happy to talk about it. So without further ado, Chance.
Hi, good evening, everyone. I'm Chance Horiuchi with the Havana Business Improvement District. I see very many familiar faces typically on the laptop. So it's good to see you all in real life and in person. I represent a special district along Aurora, Arapahoe County from 6th Avenue to Dartmouth. It's about 4.3 miles. And there's about 209 properties in that area that pay a special district tax. I manage that tax with 9 other board members that are property owners along the corridor. And the update I have tonight, there's a lot of new businesses. I won't go over all of them just because we have so many other speakers. But if you are interested, you can reach out to me. The newest one that'll be opening is bb.q chicken when you're driving by Parker and Havana. It looks like barbecue chicken, but it's best of best quality chicken. It's a South Korean franchise. I think they have more locations, I've been told, than a Church's Chicken or KFC.
Wow.
So it's a pretty big deal for us to get the first franchise in Colorado and in Aurora. They specifically chose Havana because of the new branding that's to come for Koreatown, Aurora, which actually council members and quite a few people in this room supported as well. Some of the businesses have had renewed branding. So Sir Speedy is now Resolution. I think the Irish pub is now called Sean's Tavern. So if you ever want to know about some of the newer businesses, you can reach out to me. We have some events and we have a giveaway. March is Small Business Month in Havana. So I'm doing some gift card giveaways, and just as a little preview, Meg's going to select 2 people in the sign-in sheet, so sign in, so that you can win a gift card to Coffee Story, which is a new business that many people actually do go and visit. Great. And then Pyramidas, which is the former owner of Las Hadas off of Chambers in Hamden, which I know many of you guys used to love that Mexican restaurant as well. So he opens up on Havana, in Havana and Jewel.
Pyramidas?
Yeah, it's really good. Yeah. So hopefully your name gets selected. And then lastly, the biggest announcement I wanted to share, the marketing that has gone out has been called Aurora Global Market, but they're actually going to rebrand to Havana Street Global Market. The city asked us to, not myself, but asked the event company to change the name because they thought it was too similar to the Aurora Global Fest. But as a global business district, they asked if they could use the Havana name. So in the Bicycle Village Shopping Center, which most people refer to, it's actually the Havana Exchange Shopping Center at Havana and Yale. Bicycle Village is closing, so that space will be available in the parking lot. So they're gonna host the Havana Street Global Market every Saturday from 9 to 1 from June through September. It's gonna be like an international farmers market. So what the Bonfire Events is going to be presenting this global market, and they're working very closely with a lot of the brick and mortar in Aurora to have an opportunity for them to be able to sell their goods and services every Saturday in our community. And so it's pretty awesome because it's actually in your ward. But I wanted to share that because we aren't doing summer concerts at the Rose Garden. And we aren't going to have the car show like I talked to some constituents, but we will have the Havana Street Global Market. So I encourage you to come. We're working with different partners. I think some of the city partners are going to bring in live music, entertainment, some art. So I do believe Aurora Fire and Aurora Police Department is also going to be involved and engaged every Saturday as well. So if you have any questions, Chance with On Havana Street, and you can go to onhavanastreet.com to look at some of our events. And then I'll let Meg, we'll do this after.
Don't hate me, okay?
Oh,
yeah. Okay, just want to make sure everyone's signed in, right?
Okay, right? Last chance, okay. Ready, one. Okay, Larry,
Yes.
you won.
Oh, no!
Oh, I did.
Would you please mention
Yes, he's creepy.
Do you want a Mexican restaurant or would you like a coffee shop?
I'm gonna go to Paramedes
Okay.
anyway, so.
Oh, you're
I'll try
gonna,
the-
oh, thank you
yeah,
for
this will-
supporting
this-
Victor.
this
A
will
lot
be
of
the
people don't
incentive,
know
but-
that he opened, Las Hadas opened another restaurant, so that's why I brought this one tonight.
I also just wanted to say that Bicycle Village is actually moving to Colorado, where Colorado Ski and Golf is
It's
now.
Epic Mountain Gear.
Yeah, so so basically Colorado Ski and Golf turned into Colorado Ski and Bicycles, and that's where Bicycle Village is moving to. They're in the process of moving there now, so
Good.
yeah,
So it's
yeah,
gonna
So they're not gonna be gone
Epic
forever, they're
Mountain
merging
Gear.
with the Epic Mountain Gear, which is by Sam's number 3.
yep.
Okay, ready for the second one? Here we go. Shelly.
Enjoy the margaritas and something good.
Nice.
Congratulations.
Yeah, congratulations, y'all. All right, so next up, we have Officers Tubbs and Limbaugh.
How's it going? I'm Officer Limbaugh. This is Officer Tubbs. We're District 2 FAR, so I'm Area 17, he's Area 15. We don't really have any updates for you for the entire police department, but if you guys have questions for us pertaining to District 2 or what we do, feel free. We're in my area right now, I'm south of Mississippi to Jewel and 225 to Buckley.
This is District what?
This is District 2.
Two.
Yeah, okay. 225 is the dividing line, and Ward 4 has all 3 police districts in it. So,
I was gonna say, girl, that's a.
it's a lot of fun. Yeah.
Happy to answer any questions.
Yeah, so, there's a mix up in, at least in my neighborhood, when we hear shootings right by or right at our street, we don't call, because we've been told, we've been told, unless they shoot, a building or a car or somebody, not to call, is that right?
No, that's not right. You should definitely still call if you hear gunshots.
Yeah.
Okay, and if we hear gunshots, like I live right next to the Jewel wetlands, and a lot of times we'll hear them in there. Are we supposed to call if we hear them in there?
I mean, yeah, I would, if you hear gunshots, feel free to call it in.
911 or non-emergency?
I would say 911, but you know, it's really your discretion. If you think it's just some kids, messing around or something, but it's still a gun that can still hurt somebody, so I would call 911.
Okay.
Yeah, definitely still call. I mean, when we get a shots fired call, a lot of times it's, based on how many people call it in, because sometimes if it's just one caller, it's usually downgraded, because that means, but if multiple people are calling it in, that means a bunch of different people are hearing it, so it's probably more likely legitimate, right? So that's kind of how those are dispatched.
Well, I know I was at the Jewel wetland, I think 2 summers ago, and I was calling in, but everybody else heard it, and they were quickly gathering up their kids, their fishing poles, and trying to get out. So I was making the phone calls. So because I was the one making it, then I don't think we got any police there.
Okay. Yeah, the best thing you do is just be a good witness and, get a good description or a license plate if you can.
Okay.
How frequently is this happening?
Oh, I can't tell you, I don't know.
So I live right across the street. I hear gunshots all the time on a weekly basis. I mean, I don't know whether it's fireworks or gunshots, but
Not from the wetlands though, right? You live just right back over here.
I live literally just right across the
Yeah.
street, basically Florida Station.
Okay.
And it's kind of the point where I can actually tell a difference between fireworks and gunshots at this point. But I've been hearing gunshots a lot more within the past month than I have at all. And I've lived there for 2 years now.
Yeah.
It's been pretty
But-
frequent these last 2 weeks.
Are y'all finding, I mean, I know that ag assaults are up generally, but not every discharge is an ag assault. Are y'all finding that you get more calls for people just reporting shots fired?
Seems like it's been up lately, yes.
Yeah.
And the other thing is I stay up really late, usually till at least 3 o'clock in the morning, and usually I'll hear it at around 3 o'clock in the morning. So that's why I know that why are people using fireworks at 3 o'clock in the morning? I would assume that would probably be gunshots.
Probably just,
People who are up at 3 a.m. are usually not up to any good out and about. So
Yeah,
in my experience.
yeah.
I guess, are folks just shooting this
I don't know, I didn't
into
know.
the ground? What do they do when y'all have encountered this? Do you recover casings typically when there's
Yeah,
shots
I mean, I
fired?
would say the majority of the shots fired call or shooting into cars sometimes unoccupied, cars or like a drive-by shooting,
Sure.
or sometimes they're just kids shooting rounds out of cars that are moving. They just do that, for fun or whatever.
The last summer, they were shooting at the Pelicans and did hit one.
They were shooting what?
Pelicans.
At the Pelicans. Oh my God. I thought you said pellet guns for a second there, and I was like, I did that when I was a kid. But wow, no, this is very different.
Yeah.
But like I live in kind of like a high crime area right across the street, and at the height of the pandemic, I mean, the police were coming to my apartment complex all the time, and now it's like never. So it seems as though it's calmed down a lot. Is that what you guys are seeing?
As far as it comes in waves, and different areas get hit. It kind of just randomly, depending on who's living there. If you have some gang members living in an apartment, then you're gonna have some activity over there, and then that moves on to another area. And then it's just kind of usually just comes in waves.
Does Aurora have the technology, I don't know what you call it, where they can locate?
Shot spotters. Shot spotters.
We do not.
Yeah.
Denver has that, and it's
Denver.
actually very accurate.
Okay.
Sometimes it works when we get closer to the Denver border, over like in District 1. We border at Yosemite, so it's been helpful over there a little bit.
So you said it's accurate.
Yeah.
So as I put in a council request, I think after a next door conversation, some of y'all might remember a couple of years ago.
Yeah.
And the response I got back was that this is something we could do, but they're not particularly accurate. There's a lot of false positives. And that they were concerned at the time, I forgot who it was that responded to me, but that they were concerned at the time that it would basically just take up a lot of resources because of the false positives. And with car exhaust specifically, some of these, like I have a neighbor who lives in Chatsford, and for whatever reason, he seems to have tuned his car so that it intentionally backfires. So it's very obnoxious.
I don't know if it can tell the difference between those two or anything, but just from personal experience, we've recovered shell casing
Sure.
from Denver telling us, hey, it's right here, a block into your city.
Interesting.
What's
Yeah,
the
we-
range of those?
I have no idea.
Oh,
We've actually, him and I had experience to where we've actually been out with Denver and they have work phones and the sound actually goes to their phone so they can play it and listen to it.
Yeah.
So
Okay.
it's not actually, it'll record it, but then the officer can make the
There's
determination.
discretion,
Yes.
which I like.
Yeah.
Okay.
So, and normally in our experience, you can tell.
I think it's a great tool.
Yeah.
I have it in my neighborhood. I live in Denver and I get shots a lot in my neighborhood, and so I call it in, and so they'll be able to tell me that was fireworks, or at least what they're telling me. I don't know. Like if they, is it fireworks, is it shots, or we heard 12, they're like, according to your report, that's what you said.
Yeah.
So there is, but I also, if you wanna look on NPR, I did hear an NPR article, but there's a lot of clouded mystery to it too.
Yeah.
So I think there's multiple sides to it, but I had the experience from living it, but also I've heard some kind of different things, so.
Okay. It's worth, I'll pop up with another council request on that one then. So.
And at the wetlands, I came across, it was from one of the homeless places where they were staying and then they left. And I came across about this many license plates and a slew of car keys. I didn't know, I tried to call in, but I couldn't get anybody, I couldn't get through. So I threw them away, but what should I have done with them?
Well, typically, if we recover a license, if it's not stolen, then we just have a box, we put it in our districts, which goes to the DMV. But if it's, that sounds like they're probably involved in
Stacked.
Yeah,
something.
it was a big stash.
Typically what, car thieves do is take steel plates and then put that plate on their stolen car to disguise their stolen cars,
So he could take a pick, which one he wanted.
Yeah, probably, especially with the keys. That should just be simple, like an officer coming out and collecting those if, that'd be a pretty low priority policy,
Okay.
might be waiting a
So
little bit.
I didn't
Yeah.
hear anything by throwing it away.
You could also take it to one of the districts and drop it off,
Yeah,
so.
All right.
And do you have the non-emergency number in your phone?
Yeah, but I don't. It doesn't usually get picked up.
I haven't worked as closely with District 2 because I know where I'm at is in District 1, but they're updating us on PAR. Is it gonna be the same thing in District 2 where there's gonna be less on PAR? Is that in April? I just wanted to, because I live in this area, but I work for Havana, and so I was curious, is it gonna be the
Basically, all of our, well, most of our special assignments are having to give up people to
People.
patrol.
Should I
So we're
recommend?
losing a few for downsizing. He's actually gonna be detailing to patrol here in a month.
Oh, okay. No, the reason I was asking is, so is it gonna be the same like number, so like there's an email that is the email? So the
Yeah.
PAR usually has a different card now. Before it used to be their card with their name, but I was told when PAR's on duty, they'll check that email and phone number regularly. So that's the number that I've been giving to residents and businesses. Is that the same in District 2 or is it different?
We don't have a centralized like email
Email?
for our district. We have an internal one, but we don't have one for the public. So we
Okay.
just have our work emails.
Your
that we
regular
hand out to
emails?
people, yeah.
Okay. I was just curious because they have one separate for District 1 and.
I
that's
think
what
we're
was
actually
giving.
working on doing that in
Okay.
District 2, but it's kind of an IT issue. So.
Yeah, that's why I just wanted to ask, because I know there's one for District 1, so I was gonna see if there's one for District 2. That's it, thank you.
So how long have you guys been working in the Aurora Police Department?
Be 7 years in June.
And okay, so you both were here before the pandemic.
Mhm.
So do you feel like things are starting to calm down? In terms of like, are you as busy as you were before, or like, you know?
I don't think the pandemic really had any effect on our workload.
Yeah.
Oh, so it's stayed kind of steady throughout? Okay.
Nobody else?
Well, I'm surprised to hear that because, well, we were having a lot more thefts, after, once the pandemic hit,
Well, I mean, there's certain things.
and
that are-
break-ins.
I mean, crime, I wouldn't say that crime has necessarily increased, but it's, there are certain things that we can't enforce a lot of different laws. Our jail won't accept people, that's probably the biggest problem. We're slowly getting back to normal on that, but there's still restrictions as far as who the jail will take.
What are the restrictions, sorry, because that's
Public
changed a
restrictions
lot,
still
what are
for
the
some reason.
restrictions?
There's
So
still
it used to be
code-
$10,000 bond for Havana, or
Well,
like
so I'll give you an example. We used to be able to trespassing, misdemeanor crime, $500 bond, someone would go to jail, be bonded on it.
Yeah,
Say a homeless person outside of a business refusing to leave.
yeah.
We would take that person to jail previously and they'd be arrested for trespassing and held on bond and, at least be in jail till they bond out. Now, we can't even take them to jail. The jail won't accept trespassing
Oh,
or
so that was the
low
update.
bonds under what, $2,000
$2,000.
unless it's a victim's right crime like assault or domestic violence.
Is there a way to like, because I asked a couple memos to share that, because people always ask, and I don't know what to tell them. I kind of just tell them to contact PAR, because they don't know what to, at one point it was 10,000, now it's 2,000.
We don't know. It changes every day. And
Okay.
our jail is a
I
separate
just
entity.
didn't know what I was telling people, so I didn't
The
want to
hardest
something
part
inaccurate.
is that we're in 2 different counties, Arapahoe and Adams.
Yeah.
So Adams will take basically anything, but Arapahoe won't. So they'll only take felonies over 10,000.
And that's a.
What's the
Havana's
rationale
allowed.
that
That's
Arapahoe's
good to know.
giving you?
I didn't know the why.
They just say, due to COVID.
A lot of times they're saying it's due to extradition. So if there's a jail, a warrant's out of, we had one the other day, Kit Carson County, and our jail didn't think that they'd be able to extradite within 72 hours. And they don't want people in our jail for a month. So they were gonna turn down our warrant, for a probation violation or something, so.
But it's good to know though, thanks for explaining that, because it's hard
Yeah.
for me, especially when a resident asks and then the
Yeah.
business asks, it's like 2 different
Oh.
responses, so I
It
don't know.
varies, it's crazy to us because it never used to be call and find out if they'll take this warrant. Every
Yeah.
warrant you would go to jail on any warrant, years ago, before, I guess before the pandemic, before,
Mhm.
legislation and stuff that's passed, we were able to take people to jail for anything. But, there was a jailable offense or a warrant, and now we have to call and, jump through hoops to.
Yeah. And that makes sense, because what happens is, like you said, you can't trespass them. So in my experiences, they come back the next
Yeah.
day and do the same crime, or they stole 1 car the first time, got in trouble, and then the second time they come back and steal 5 cars,
Yeah.
with an organized group. And
Mhm.
so that's why I was curious when they can go and when they can't go,
Yeah.
and what the crime is that they can.
And there's certain circumstances where we've had someone with 12 trespassing warrants.
Okay, so that's
Where
the,
they
okay.
have,
That's
each of
good
them
to
are
know.
$500 bonds and our jail will accept it because obviously they're a chronic offender, so they'll make an exception for that, but it all depends.
To answer your original question, I don't think crime has necessarily gotten worse, but it's just perceived like that because we can't enforce as much as we used to be able to.
The body cams, I see the body cams on your body. Colorado just recently passed a law. So I think, what was it, by 2023, the cameras have to be rolling at all times? Is that what it is? Do they require you to have the camera rolling as long as you're clocked in?
Contact with the public, yeah.
Okay. Interesting.
So are we on candid camera?
Actually, yeah, you are. See, I mean,
Just recording.
yeah, there's all kinds of cameras in here.
All right. So, are there any more questions?
Thank you.
Thank you both so much.
Thanks, guys.
Yep. Deputy Chief Rob Net, you've got it.
Hello. A brief update for Aurora Fire is we're excited. We had a academy start on the 22nd of February. Right now we have 23 in that academy. So kind of the way it works for us is our goal is to be fully staffed December 31st. So we have natural attrition, and so we hire for that in January. Now our staffing is based a little bit different than our partners. They have the 2 per 1,000, and you hear about that every now and then. We staff on effective fire force. So if there's a structure fire, we want 12 people there within 10 minutes. And that's how we base our staffing model. So we're excited. We had 2 phases. First year we did a 2-phase academy. We did a fast track academy that started January 3rd, which is 8-week academy. And that is for lateral hires that have extensive experience in the fire service. And we bring them in before that academy starts, and we test their skills, see if they'll be successful. That evaluation doesn't determine if they're hired or not. It just determines if they go to fast academy or a full 22-week academy. So we just started that 22-week academy. We're really excited about that. What else have we got going? We are, and what I need you folks for is we are starting to recruit much, much earlier for next year's academy. And so you all know people who, young, ambitious, people who have drive and are looking for a career. You're not gonna find a better one. Second best. Average career for a firefighter is 22.5 years. You don't hear like that a lot in society nowadays. So we are encouraging you to bring them down. You go to the civil service website, you can see the application process, and we really want to get a jump start on next year's academy.
What are the qualifications and age?
We hire at 18. Okay, we have not yet hired at 18, but that's the minimum. High school diploma or equivalent. And right now we will, if you are a naturalized or a green card or legal resident, you don't even have to be an American citizen.
There must be a maximum age.
No.
Stacia, your new career.
Yeah, when I was in the training academy, we had a 44-year-old go through. You did very well. We don't discriminate.
What's the percentage of women in the Aurora Fire Department?
You know, surprisingly, we have done really well with recruiting women. We're a little above the national average, so we have right around 10%, which is really good. We're struggling elsewhere for diversity. And I did recruiting for a number of years, and recruiting for in cultures that have traditionally a distrust for authority is really challenging, and it takes effort. You have to be intentional about going and recruiting and selling your agency. So it's tough, especially during COVID. We couldn't go places. Yes, ma'am.
During training, and do you repeatedly train people how to write a reports?
Okay, so we don't write reports
Like
as
for like a
often as
fire.
a police officer does. And typically the reports are written by the paramedics and the officers. So paramedic, once you become a firefighter, within the first 4 years, you should be able to go to paramedic school if you didn't come to us as paramedic. And writing reports is a significant part of paramedic school. So that's really where they get it. They'll get basic report writing in the academy, how to operate our records management system. And then while they're on probation, their probation starts the day they graduate and goes for a full year. And their officer in the station will have them writing reports and teaching them, mentoring them on writing reports.
Okay, the reason I'm asking
Mhm.
is because we had an arsonist start a fire, 3 fires.
Oh my.
She was in jail for a while, but then when she went to court, she got off because the fire report wasn't right, nor was the police report.
Oh my.
So that's why I'm asking what training you guys want.
Is
Yep,
this the
she
same
got
gal
off.
that?
She got off.
Right.
And not only that, we might even be, or we may, I don't know if she might, but she could sue us for keeping her in jail for that long.
That's a disturbing story, man.
It
That
sure
should
was.
never happen. And I
It
was
was
an
a big
arson
fire.
investigator for 6 years. So I went to police academy in 1996. I'm an old firefighter. So, when you become an arson investigator and you go to police academy, you become post certified, then you have all their report writing skills that you have to accomplish as well. So that really shouldn't happen. And I'm sorry that did.
Me too.
Yeah.
Seen her lately?
I was gonna ask.
We saw her when she was released, but we haven't seen her around lately, nor her boyfriend.
Yeah.
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 All right.
All right. Any other questions? All right. Thank you
I'll
so
be
much.
here all night if you have anything.
Thank you.
All right. Awesome. So moving on with our agenda. So we're gonna go into the Arapahoe County Health Department presentation from Commissioner Baker.
Hi, everyone.
Hi.
I'm Jeff Baker. I'm hitting back up tonight for several people. We're not in my district. I represent the eastern part of Arapahoe County, which is the eastern part of Aurora, eastern part of Centennial, and the communities of Watkins, Bennett, Fire, Strasburg, and Deer Trail. So that's my district. I'm on my second term. I was elected first in 2016, took office in 2017. I was reelected in 2020. So we have a maximum of 3 4-year terms, and I'm very happy to be here to talk to you. Prior to being a commissioner, I was an employee of Arapahoe County. So I just went over 23 years with Arapahoe County. Prior to that, I served 5 years with the Aurora Police Department as a civilian, doing crime scene investigation. I was the CSI supervisor for Lieutenant Dufour in the crime lab. And Chuck E. Cheese was my first crime scene for the city of Aurora when I retired from the Army. And so, going way back with Aurora, arson investigations and things like that. But I'm here today to talk about what Arapahoe County is doing to create a single county health department. We wish we didn't have to, but we do. So, are you?
I'm driving. I
Great.
gotcha.
Excellent. So there's some good information here. Tri-County Health Department's been in effect since 1948. Now that was with Jefferson County, Adams County, and Arapahoe County to begin with. At one point, I think around 1964, Jefferson County formed their own health department, and Douglas County came in. So it's been your health department in the city of Aurora for decades. Now, what happened, many people read in the papers, in fall of 2021, Douglas County announced plans to form its own health department. There's a lot of history going back to why they made that, the 3 county commissioners in Douglas County. Maybe I should explain that. Douglas County has 3 county commissioners. They've elected to remain at 3 county commissioners. Both Adams and Arapahoe counties have 5 county commissioners. And I can say this, is that Arapahoe County is between Adams County and Douglas County geographically and politically. I'll just put it that way. So, shortly after Douglas County made their announcement, Adams County also announced that they were, they had intention to leave Tri-County Health Department. And that sealed the fate, basically, for Tri-County Health Department. We made overtures to both counties at various times to try to preserve Arapahoe, to preserve the Tri-County Health Department. And it just became clear that that was not something that we were going to be able to do. So Tri-County Health is currently a district health department because it's 3 counties. There's an economy of scale that comes with being a district or a regional health department as far as grant money. The more people you serve, the more grant money you can get. And Tri-County Health Department is heavily dependent on those grants. When we become a single county health department, those grants will come to us based on solely the single county health department in Adams, in Arapahoe, and in Douglas. But I'm again here to talk to you more about what Arapahoe County is doing, because the majority of Arapahoe County lies within the city of Aurora lies majority in Arapahoe counties. About 2/3 in Arapahoe County, 1/3 in Adams, and it's median.
2 precincts.
2 precincts.
One, 2?
Is it 1 or
2
I think it's one.
precincts
I think it's-
down in Douglas County. So,
Yeah.
it is going to, it will cease to exist on January 1st, 2023. And we will have the Arapahoe County Health Department, which we haven't really named, but that's what we're calling it, the Arapahoe County Health Department, up and running by that date. So next slide. This I'm gonna just go over very briefly because we've had to become students. We were talking about the classes that we're taking and things that we're doing. We are studying all about what public health is. And so there's some information on this. The main thing, it's different from your health care, your personal health care, your primary care physician, whether you are covered by Medicare, Medicaid, United Healthcare, whatever your insurance, if you have insurance, or whether you go through the state medical insurance, it's different. The way to think about it is that when you go to the doctor, the main concern is treating you. Public health is wants to keep you from getting sick in the first place, and it is the community public health. So smoking is a good example. Many years ago, we learned that smoking can lead to many, many different health problems, and if you go far enough back in history, you'd be able to find a room full of people like this smoking cigarettes inside, and so there was secondhand smoke and things like that.
Doctor recommended cigarettes.
Yeah, there were some. It was amazing. But through education and law changes, that's no longer the norm. Rather than treating one person who smoked and had health problems come about it, we try to focus on education on preventing people from smoking. So, next slide. Here's, again, some of the areas of public health. I won't go into a lot of detail about this unless there are questions later. Communicable disease control. Many people prior to the pandemic, this is the thing that when people traveled overseas usually brought some kind of disease back with them and they were quarantined. That was really one of the powers of the public health department, and it's given by, there are some that are national United States laws, And then there are some local, state health laws that give authority to public health entities to issue public health orders, such as quarantine. Shutting down restaurants was something that happened. They do inspect restaurants and things like that. That was the thing that, for Arapahoe County, Tri-County Health Department would come in prior to the pandemic and give us an annual report. Now we get, during the pandemic, we were getting at least weekly, if not twice a week, reports on what actions were being taken to fight COVID, and public health orders for masking and shutting down businesses and things like that. So, emergency preparedness and response. The Arapahoe County Sheriff's Office. I was gonna say, if anybody has more questions about why the jail. I'm not Tyler Brown, but I know him pretty well. He's the sheriff of Arapahoe County, and he's helped make those decisions about how many people can come into the jail, and that's really what those restrictions are based on. It's to prevent more disease, and I won't go into anything more about that, but emergency preparedness and response. Our sheriff's office does emergency preparedness and works with Tri-County Health Department. Maternal and child health is very important. WIC program, the Women, Infants, and Children's program, serves a lot of folks here in Aurora. Reproductive and sexual health is another action that Tri-County Health Department is currently doing, and testing, tracking sexually transmitted diseases, including HIV. Behavioral health is another one of the things that, it's an umbrella term, and we have a lot of partnerships with community organizations such as Aurora Mental Health and different things like that. Immunizations required for school, physicals for kids in school that are going to be participating in athletes, things like that. Consumer protection, environmental protection, those sorts of things. Next slide. So,
Sorry to interrupt, folks, we're gonna take off unless you guys have anything else for us, but.
Appreciate y'all being here.
Thank you.
Take care, have a good night.
Thanks for what you do.
Thank you.
so now that you kind of see what we're trying to decide, Arapahoe County is trying to decide which of those and at what level we will still be providing those services. Some are required by law and some are not. But in order to achieve these goals, we want to make sure that we are consultative and collaborative. We're going to listen. We're going to touch base with residents, businesses, and community groups. We want to make some fiscally sound decisions based on industry best practices and communicate. So next slide. To help us reach these goals, we hired a consulting group called Otowi, O-T-O-W-I. They're a group that specializes in public health. And one of the folks, Lisa, comes from the School of Public Affairs, University of Colorado at Denver School of Public Affairs, to help us better understand what Tri-County does and what our public health department options are. We meet with them, the commissioners meet with them weekly. They have other meetings with staffs. We have an internal team, a project team that is working with Ottawa, Tri-County Health, CDP, Colorado Department of Public Health and Environment, and anyone else, basically anyone that you could consider a stakeholder. Now these meetings are streamed live through our website so citizens can attend. And you're invited to listen to those meetings. The recordings of any past meeting are also on our website. What's legally required as well as what's optional. For instance, in the Colorado Revised Statutes, smaller counties, which are defined as any county under 100,000, Arapahoe County has 660, 670. We're still waiting for the final numbers from the 2020 census to come in. 650,000 people, over that. So we're way over that. But smaller counties under 100,000. First of all, those folks will always have 3 commissioners, not 5. You have to be over 300,000 to move to having 5 county commissioners. But so in those smaller departments, the county commissioners can be the Board of Health, but not for larger counties. So we are required to have a Board of Health, anywhere from 5 to 9 members, and they cannot be from the same industry. So, for instance, we cannot have all doctors, which seems counterintuitive. That you want doctors, and we will have some doctors. We will have doctors, nurses, medical professionals, but they can't be the overwhelming influence on our Board of Health. We can have some elected officials, and we're debating right now whether a commissioner, 2 commissioners, a city council member should be on our Board of Health, and how that will look. So that's called governance, and that's what we're looking at right now. The fact that we are changing from being a district health department to being a single county restricts our funding, like I told you about grants. But also, can we then partner with Adams County or Douglas County for certain of those health services that we know we're going to provide? Or does it make sense for all 3 of us to contract for that service, for sexually transmitted disease testing? And would that be a better way to manage the money? Now, one of the questions I'm asked about this, are our taxes going to go up because of Tri-County Health Department being eliminated? And right now, because I can only tell you what Arapahoe County is doing, there are no plans right now to try to increase property taxes. We would have to go to a vote of the people in order to do that, either sales tax or property tax anyway. Right now, we're not discussing that. We're going to be able, and we've already set money aside. We can use ARPA funds for this, if you know about ARPA funds, American Rescue Plan Act funds. So we can use ARPA funds to help us get this set up. So it's not going to affect individual taxpayers for us to do that. Main thing we're doing is trying to just learn as much as we can and make smart decisions about that. Next slide, please. So here's our methodology. You can see kind of a timeline. We're going to define the services, gather requirements. We've already done that. We're now in the prioritization of services. Then we'll go into the solution evaluation, implementation, testing and validating what we've done, and then again going live as far as January 1st, 2023. It's an aggressive schedule, but we believe that we can do it. I don't know how much inside baseball to go into. We've been asked by Tri-County if we would consider extending that, because, and it would have to be all 3 counties that would do that. And I don't believe we're gonna be able to get to the point where we could extend it to a later date. But, so right now, January 1st, 2023. So that's a little bit about the methodology. Timeline, we have another timeline, next slide. We anticipate, if anyone is really interested in this, you can look at all of the scheduled meetings on our website, and then you can attend the meeting on the 29th of March. The end of March, we are going to have a very good idea of what our health department will offer at that time, and we will then determine options, whether we contract out, partner with other counties, or example that I gave you before. and this is the part Bill Holman was supposed to go over, so that's why I'm not as up to date. I studied my part.
I'll be sure to tease him about that.
Yeah. We're going to actually be testing the implementation in the third quarter of this year so that we will be ready again for January 1st, 2023. I can't stress that enough. That we have a hard deadline for that to happen. Next slide is about governance. Again, we must have a minimum of 5 members. Are more appropriate. We can have as many as 9, should there be elected officials on that. That board is by law designated to hire a public health director. All 3 counties are currently looking at hiring folks from Tri-County Health Department because they are our experts. And so it's kind of like, we call ours Operation Kickball. We were gonna call it Operation Red Rover, send so-and-so
Send
on
Tri-County
over.
on over.
Yeah,
That's right.
so the
First come, first serve.
yeah, kind of it. Who can offer the best services? These are folks that are in high demand, not only here, but all over the country right now.
Yeah.
So, lot of options. The medical, if your executive director is not a doctor, then you can contract with a medical officer. There are several counties in the Denver metro area that contract with Denver Health to provide the role of a medical officer, and they have like 12 doctors. So you always have a medical officer you can call upon, even if someone's, taking a vacation or ill. So that's an option that seemed pretty reasonable to us. The cost wasn't all that great. So all these different options we're looking at. Next slide. This is probably what you're looking for. Challenges for Aurora, and they've even got a little map there.
Yeah.
The city is large enough that it crosses these 3 counties. Rather than all of Aurora being served by Tri-County Health, residents in each county will have a separate health department. That's sad, but we're glad. I think the majority of the folks here are Arapahoe County residents. So Arapahoe County will be providing your health care from this point out. We don't know how that will play out for Aurora financially or practically. It's also likely to be very confusing for residents.
So I don't want to put you on the spot.
No problem.
And I'd love to get y'all's opinion on this too, but from my perspective, as you mentioned, the bulk of Aurora is in Arapahoe County. I think our residents are accustomed to being in Tri-County Health. I think that we're likely, or rather Arapahoe County is likely to grab, I think, the lion's share of those folks, hopefully. Would there be any interest in entering into an intergovernmental agreement with the city of Aurora to basically have Arapahoe County Health serve the entire city?
That is very doable, and while I cannot speak for the entire Board of County Commissioners, I can only speak as Commissioner Jeff Baker. I know and let me just tell you this too, Arapahoe County Commissioners, we're politically diverse. We have 2 Republicans, I'm one of them, and 3 Democrats. We like each other. We are respectful to each other.
This is a shock.
We have civil discourse. Nancy Jackson, who's our chair, she's a Democrat. She's one of my favorite people in the world. I respect her so much. And so when I said we were between Adams County and Douglas County, we are unique, I think, in that, and we want to keep that up. We're willing
I'll
to
just say I'm
consider.
very envious of the relationships y'all have.
Yeah.
So
I've seen your meetings.
I know.
Not for very much, turn it off.
Yeah,
But
you don't need to bring.
It'll affect your mental health.
Yes.
Watching those meetings.
But yeah, we're willing to consider anything. Anything that's legal, ethical, and moral, it's on the table, and if it makes sense, which I think that does.
I think so.
Yes.
Would that then affect the funding level? Would
It
Arapahoe
could.
County Health Department be able to receive
It's-
a larger grant?
The grants are based on population served. The state health department doesn't care about boundaries. They really don't. So we could partner with Jefferson County. We could partner with Adams County if they decide that's what they want to do. So far, again, they haven't been real receptive to any overtures. Douglas County, we all know. We're not, even though I'm a Republican, and they're all three Republican down there, I'm not very happy with Douglas County. I'm pissed, to tell you the truth, but
I'll say
it's
you're
possible.
a different breed of Republican, and I appreciate you.
Thank you. I take that as a compliment, so. So it's, next slide. We need people to stay involved. We have a telephone town hall coming up on March 30th. So the 29th is when we'll have a public, or a study session is what we call them, work session, where we will get recommendations from our staff and kind of tell people how it's going to look. And then we're gonna have a telephone town hall on March 30th. Feel free to take a picture of this if you'd like, or if you wanna send the program, the presentation out, that's.
I would love to. In fact, if we can just get this little wrap. Actually, I have your presentation here. I'll just post something when I get home tonight or tomorrow morning.
We want people to stay engaged. Yes, please, feel free, it's public. We're posting weekly surveys on our website to ask folks specific questions about what they would like to see from their health department. Like I say, a lot of people have not had any interaction with the health department unless they ran a restaurant. They had a well water, and they had their water tested.
Which I don't think we've done in Aurora, a well application in 30+ years, I think, so.
Yeah.
Yeah.
Indoor air quality, sometimes if you think that you have mold, they'll come out and test for mold and things like that. Although there are a lot of contractors that will be able to tell you about the mold in your walls. But as we begin to schedule more events, we'll be sharing those in our weekly newsletter from commissioners and also on our website. So please sign up for those surveys and stay involved. And I'd be happy to answer any questions that anyone may have. Yes?
I have a couple, and it mostly has to do with underserved neighborhoods.
Mm-hmm.
And I'm not sure if my questions are in your bailiwick or not.
Sure.
Whether or not you looked at what's working and what's not working, that needs to change. And when you talk about putting out information, a lot of people don't have computers.
Yeah.
How are you going to get input from those underserved neighborhoods?
Well, Tri-County Health Department is currently serving those underserved with vaccinations, physical exams, WIC, and things like that. So they're putting this information out too about how to participate. In fact, when they do visit the Tri-County Health Department, they're a partner. Even though Tri-County Health Department is going away, they're a partner in this process to set up the new one. So they're serving that. Most of the information that we get about underserved populations are from the census tracts. And those are all mapped out for us. So we also provide other services to those folks through our Human Services Department. So if folks are signing up for Colorado Works program, or otherwise known as TANF, Temporary Aid to Needy Families, aid to families with dependent children, SNAP benefits, food stamps, any of those programs, they're already coming to our county buildings for these services, and that's where we're making contact with them and getting them to help us decide what services are necessary.
Has anything jumped out so far?
You know, sexually transmitted diseases, it can't, reproductive health, while Tri-County Health Department doesn't currently offer abortions, say, they do get people onto birth control and things like that. That's huge. Right now, everything's so COVID focused that I think we're seeing, thank you, we're seeing quite a few folks that used to be in environmental health. By the way, Adams County has more industrial health needs because of Sancor. And they have a lot more industry than we do in Arapahoe County. So we may not have as many people focused on industrial type health as maybe Adams County has had. So those are all decisions. So that's how we've been trying to reach out to those underserved populations.
Where do you think that maybe the two top areas are for the underserved?
Well, it's going to be the contagious diseases is always going to be.
No, I mean, where are they in Aurora, the places that you think are the
Location.
underserved?
The most underserved, North Aurora.
Yeah.
North Aurora, Colfax corridor. Yep.
So we have 11 in Aurora, 11, now we used to have 12, 11 mobile home parks. So I would say those are spotted almost all exclusively in Ward 2. We used to have one in Ward 1, now they're all in Ward 2, is that correct? I think they're all in Ward 2. And then original Aurora, kind of that area, I call it the newcomer corridor, Colfax corridor, there's lots of different names. We have approximately 168 languages spoken in Aurora, most of which I would say is kind of centered around Ward 1, some in Ward 2, et cetera, et cetera.
Is there gonna be a different approach to those areas with this new health department?
I think they're gonna focus just as much as Tri-County has. Again, it's gonna, I'm pretty sure that I can say, I believe a lot of the Tri-County health folks who are familiar with Arapahoe County and the neighborhoods in Aurora will be coming to do it. And that's our hope.
I can only imagine that, some of the immigrants who really are hesitant to.
We use the City of Aurora's immigration office. I'm not sure if that's the right name for it.
The Office of Immigrant and International Affairs.
Yes, quite a bit for interpretation and things like that.
And there's a lot of partners working with newcomers, refugee communities, resettlement, and there's a whole public sector and nonprofit sector that's where I come from. So, I mean, there's an extensive people that are.
Including illegal folks.
Yeah, undocumented, yep. So there's a lot of good health services and much more needed. I could, it's a whole other conversation for a whole other night, but yeah. Yep.
Other questions that I might be able to answer?
I've got one for you.
Sure.
So counties are responsible for public health. You also get housing,
Yes.
responsibilities, things like that. Do you suspect that with the changing of the structure, we'll be able to build a better partnership to address the unhoused situation in Aurora and other cities in Arapahoe County?
I think that's underway, and it's partly the health department, but it's also ARPA funds.
Sure.
We are, the mayor came and spoke to us the other day about the campus.
Yes.
There's two campuses, one off of Potomac, I believe.
Yes, so that one's in Ward 4 over here off of Potomac,
Okay.
in South Mississippi.
And then the other one out at a little bit
North,
into Adams County. Yeah,
Or fits in the
fits in
Fitzsimmons
this.
area.
And
yes.
then we've got in Arapahoe County, we've got the Ridgeview that we're working with the state on, and we're going to partner on that. I think, well, I don't know that we'll meet the need. The need, and as Juan said, the county is responsible for these housing initiatives. Why do cities do it then? Because it's grown so much. It's beyond the county's ability. Most of our HUD funds come to us and they're used for affordable housing, helping to the Brothers Redevelopment Corporation. We give a lot of money to the cities, we actually channel most of that money to city endeavors for homelessness. And then we do rent, assistance and vouchers, motel vouchers. And by that, in the past years before CARES funding and ARPA came to us, we expended every last penny of that. And there was still more need.
Oh, yeah. Yeah, the reason I brought that up is, as Commissioner Baker mentioned, we have to get involved. If we leave it all to the county, it's not that they don't want to help, it's that they don't have the resources. So that's why it's gotten to the point that it's at right now. That's why we have all the camps. And, you know, Ridgeview I'm very excited about, because that's gonna be, I think, the first new permanent supportive housing in the Aurora area since Providence of the Heights was built and completed. But Providence of the Heights serves 50 people, which I'll talk about in a little bit here. And this campus, if refresh my memory, it was gonna be closer to 300,
Yeah.
but it's not just Aurora though, it's
No,
gonna be.
It's
statewide.
gonna be the Denver metro area.
Okay.
Which is the campus that's right here. I mean.
We don't have one currently.
Are
But
you
you said
talking-
it's south of Mississippi.
Oh,
and
okay, that
Potomac.
one's new, so that's actually an initiative, it's not just for the unhoused, it's for Aurora Mental Health.
Yeah.
So, and part of what they have is, the vision they have for the campus is a smaller permanent supportive housing development on campus, which is great, because it's right there where, you know, right next to the hospital and right next to their future, headquarters, so folks who need mental and behavioral health services are gonna be literally walking distance. to the
So are
same
we gonna be
facility.
getting more people in then?
I mean, that's gonna be designed to take care of the population that's here, is my understanding.
Tri-Cities is doing their own
Yeah,
initiative.
Right.
That's Sheridan, Englewood, and Littleton.
Yeah.
They've got an initiative that we're helping them get done. I've heard about the Village Exchange, is that something?
Village Exchange Center, is not gonna, so
No?
those are the folks that are kind of like more in the continuum to help
Okay.
new immigrants.
Okay.
Incorporate, kind of
Changing the trend?
Changing the trend is not
I'm
one
not
that comes to
sure.
mind. No.
Some of these groups I just
There's a lot.
know because they come to us and they say, we need money, and we say,
Right.
here you go, this is what we can give you.
Right, yeah. I do want to actually highlight the Tri-Cities area and the study that they put together on homelessness.
really good.
So before I moved to Aurora, it feels like a lifetime ago now, I lived in Englewood. And they put together this awesome study where they actually went out, talked to the unhoused community that they have there, and gathered information as to how people actually become homeless and what contributes to it. And I really encourage you all to check that out. It's about 30 some odd pages if memory serves. You don't have to read the whole thing. The executive summary is fairly detailed. But it really, I think, debunks a lot of what you hear about the homeless, that they're all drug addicts, they just want to be out there, it's a lifestyle choice, etc. It humanizes, I think, the struggles that people are going through. And I think that is really useful information to have, because it'll help us better serve this population and get them off the streets, which I think is what we all want at the end of the day. So.
Okay, Juan, I'm kind of, I don't know if we're gonna bring more people in, but I have been cleaning up after the and I am worn out.
Yeah.
I am disgusted by what I pick up, what I put out, the number of fires I put out,
I know.
the animals
Literally.
that I've had to
Yeah.
take care of because of different things that have happened to them. I'm scared. So if you're gonna be bringing more people in, I just don't know how we can handle it.
No, so I want to be clear, the facility that Aurora Mental Health, their campus, it's going to be over by the medical center, that's to address the folks who are already here. There's, believe me, y'all know, you see it, there's plenty of need here already.
Yes.
The Ridgeview campus is not in Aurora, it's out close to the fairgrounds.
It's in unincorporated
Unincorporated
Arapahoe County. It's
Um,
east of the fairgrounds.
Yes, and it's far away from the city, which I guess
It's
from a
been
security standpoint, I think will help. It's over by Dad's, by the landfill.
Yeah.
So it's like literally almost backs up to it.
Been a state-owned,
It was a troubled youth center.
juvenile,
Yeah.
Confinement facility, basically.
But the transportation isn't, I mean.
There's
we
no
have
transportation for those folks there.
Not
Which is
yet.
why we
Sorry,
have.
Not
it.
yet.
Okay.
We're
good.
gonna take care of that.
They have a lot of problems at that one on Potomac. I wish the police officers were still here.
Which one on Potomac?
Like,
Are we
the
talking
one
about
you're
the
talking
camp?
about- Yeah, by Potomac, right by the hospital, the mental health.
The one that migrates all the time? Are you talking about the camp, or are you talking about that facility specifically?
That facility.
Okay. That I had not heard about, so I would have liked to have heard that from
Yeah,
the
I wish they were still here.
Comitus is up in, over by,
On the
Anschutz.
15th.
It's on here.
On the
Yeah,
15th.
yeah, they have a, yeah, okay,
Yeah,
so if that's where, okay,
yeah.
sorry, I thought you were talking about Ward 4 already. No, and yeah, that's true. That, it's because of the Day Resource Center, and I just want to be clear, that's not permanent supportive housing.
It's not.
That is literally a place for
Right.
people to go
For
get
shelter.
services
Yeah.
and like get like some food, maybe, they have cots and stuff like that.
Unless-
And part of the problem is that since these folks are not being housed, not being connected to those services, that's a plot, when you bring these folks together, you gotta remember, they're just like any of the rest of us. We have community members that we're familiar with, we're friendly with some, we're not so friendly with others. Tensions rise, a lot of these folks have underlying, mental health disorders and behavioral health disorders, substance abuse issues, and that's when things can get violent, and yeah,
They
that's when the
need
police
to
get involved.
find the root cause of each
Yep.
and put them in groups and go from there. Because I did a lot with the homeless
Mhm.
for 14 years. A lot of them don't wanna go into a facility, period.
Not, especially not the kinds of
They're
facilities
not
that we
sick.
have.
They're
That's
not
true.
sick. No, they don't wanna follow rules. I used to talk, they don't wanna follow the rules. They don't wanna give up their drugs. They don't wanna give up their drinking. So what are you gonna do about them?
So I'm not disagreeing with any of what you're saying. And part of the thing is there's different, let's say, tiers of folks in terms of receptive to being served,
Somebody needs
right?
to get to the root
And-
causes.
yes,
And
I agree.
then put them in categories to figure out.
All right,
How
so
you gonna fix this?
in my spot, we're gonna talk about this a little
Oh,
bit.
okay.
I had a shorter
Sorry.
presentation and we're already over. I'm so sorry for the tech issues. Like if you need to go,
No,
Deputy
no
Chief.
problem.
Well, sure. Yeah, like
I'm
if you
right
need to
there.
go, that's cool. If you're enjoying the conversation, please stay. I don't want you to feel like I'm asking you to leave. but- Yeah. But I want to be respectful of y'all's time as well. Yeah, are we done with Commissioner Baker's? I think it's
No more
actually.
questions.
So.
It's very nice to meet you all tonight.
Thank you.
Thank you so much, Commissioner Baker.
You want me to leave a couple business
Please
cards
do,
in
please
case
do.
anyone has any questions? Juan can make sure, and let me just tell you another thing. Like I said, I'm a Republican.
Yep.
But in the couple of instances where Juan and I have had a constituent approach us about something, he has been very responsive and very quick to get things solved. So
Yep.
I have really enjoyed
Well,
working.
one
Yeah,
was,
I
Yeah.
very much enjoy working with Commissioner Baker as well. Can you give me a hug?
Sure.
You're a great guy. I really appreciate you. Thank you so
Thank you
much.
all.
And here are the cards, folks. So you're
Thank you.
supposed to hold them up, so take one if you want them.
Good evening.
And I'll keep the remainders next time I see them all.
I'm saying, do
Oh, yes, please pull up my little spot too.
is it on?
Yeah, so it should be PowerPoint, should already be open. There it is. Just, yeah, full screen it and let's go. So I put together a short little slideshow, because I'm gonna do more talking than pointing back at a screen behind me here. All right, great. So, yeah, I just wanted to let you know a couple of little things that are coming up here in the next month or so. So let's go to the next slide. The first one is permanent supportive housing. So let's just pick up that conversation where we left off. So you're right, with what we currently have in Aurora, we have a small shelter, that's the Combined shelter, right, with about 150 beds. We have the Aurora Day Resource Center, which is exactly what it sounds like. It's just a place where you stop in to get stuff. Combined is the closest thing to a legitimate shelter that we have. And then we have motel vouchers and a couple of other kind of scattered services. What I like to call a patchwork of services that are designed to manage homelessness rather than solve it, right? Permanent supportive housing, and this is a specific kind of philosophy from the housing first bucket, right? Is the single most effective way to actually get folks off the street and into care. And to get even the folks that you're talking about that are very difficult to access, especially at first, they're like, nah, leave me alone. I just want to do my drugs. I want to sleep out here. Screw off, right? Like I don't have time for you. Over time, when we start addressing the folks that are easier to reach, that are in these same people's communities, those walls come down. And this is why, I'll talk a little bit about the camping van, but that's not what I was going to focus on. This is why I'm adamantly opposed to the camping van. Because the more we push these people around, you have to understand, I don't like seeing the camps out there either, right? We have that one that's right off of the ramp right now across from the Euros, right? We have the ones that travel around the medical center and the wetlands. And oftentimes, these are the same people that just get swept here, so they end up here, and they end up here, then they end up at Mississippi. Then literally they'll go down to Horseshoe Park, right? And I'd go out when I was able to drive and see it's the same people, the same red tent, the same other tents, who are literally just getting pushed around the city. We're not accomplishing anything, right? And the more we push these folks around, it's gonna be harder for when we actually have real solutions in place for these folks to come out and be like, hey, I'm not here to make your life miserable again. I'm here to actually offer you a place to live and connections to, mental health services to get you into detox. Every time we further traumatize these people, it makes that end goal that much more difficult. And I don't have it included here, but I did write a blog post about this. So for those of y'all who don't go to my website, I do try to update it now. I'm trying to get into the habit of doing it weekly to kind of recap our meetings, both council meetings and council meetings and study sessions. Houston is an example that I've been pointing to lately. I used to point at Helsinki because it's by far, I think, globally the most effective one that we've seen. Houston's local, so we have the same federal government, so I think it's a little more applicable. I used to live in Houston as well. I grew up in Houston before I moved here in 2007. So Houston had a massive homeless problem when I was growing up. They had 8,000 plus unhoused people, right? Denver has 3,000, so if you think Denver's bad, just 2.5 times that population, that's what we're talking about. Over the last decade, they have cut that in more than half. Yeah. And they're projecting in the next 5 years or so, they'll be able to reach a functional zero. Functional zero meaning no more like rough sleeping and that population growing. That means that as soon as people fall into homelessness, they're going to be able within 30 days to get them out of homelessness, right? So that means you might still see a person down on their luck for a couple of days in Houston, but that's not going to be their permanent situation. The way that they did that is through permanent supportive housing. Houston also passed a camping ban in 2017. And I bring that up because when they started this program, the permanent supportive housing program in 2010, that slide, that decrease in the unhoused population was like a ski slope. Like you're coming way down really fast. That camping ban went into effect, and now they're jigsawing. They hit a plateau because that makes it harder to serve people. So my big concern, I'm still gonna push this policy, but my big concern is that we're shooting ourselves in the foot before we've even started to actually try to fix the problem by doing this. Because those 2 officers that were here, those people are gonna see them as the bad guy next time they see them. And they're gonna see our street outreach team as the bad guy next time they see them. And they're gonna be less receptive to accepting help when we actually have this program in place.
What are the police doing with the homeless?
They're gonna be involved in sweeping the camps.
So
If you remember Chief Wilson, when we discussed this last year with the old council, she said, I am adamantly opposed to this. My officers don't want to do this.
They're
This
not
is going
doing
to.
it now.
They aren't. They're doing a little bit of the oversight, unfortunately. Depends on where the camp is at. So if they're in a city right of way, then APD does show up for support. If they're in where the big camp still is, I think, over off of Parker and Vaughn, that's Colorado Parks and Wildlife, right? So that's the rangers basically show up. Sometimes they get backup from Arapahoe County, the sheriff. And on CDOT, State Patrol shows up.
Yeah.
So,
Right.
yeah, but you get what I'm saying. If with the intergovernmental, so I actually got staff to put out an intergovernmental agreement with the goal of cleaning up trash, right? Because I was hearing from all of you that there's a lot of trash that these camps leave behind, right? So our roads look crappy,
Yes.
the on-ramps to the highway look crappy, and CDOT takes forever to come out here because they have a massive network to manage. So we got into an intergovernmental agreement with them, which I'm very excited about, but they wanted to give us money to sweep camps too. So my concern is we're gonna be in a situation where APD is gonna also be sweeping the camps on the highway, which is, I think you will all probably agree, where most people camp. And then once they get swept there, that's when they end up in the jewel wetlands again. That's when they end up on Horseshoe Park, et cetera. So we're going to dig ourselves into a hole because our timeline now is faster. Like you've heard me say, we're accelerating the game of whack-a-mole, right? It's like when you get to the end stage and the little things are just popping up like crazy. We have 3 days now if they're on the city property. CDOT's still going to be 7 days. Colorado Parks and Wildlife is whenever they get to it, I guess. I mean, that camp has been out there since as long as I've lived in Aurora, I think, honestly. You can go on Google Earth and look at the, switch to satellite view and look at the ramp around Cherry Creek Park, and you'll see the tents. They've been there for a long time. So, yeah.
Well, I'm confused, because the last stuff that I heard and read about was that the people couldn't be moved unless there was a place to put them home.
So that's the rhetoric that is used, but if you can look at the minutes from our Housing and Neighborhood Services meeting, I want to say last month, where I'm on that committee now, so I'm very excited about that, but we kind of grilled City Attorney Joyce about that, and he kept changing his answer depending on how you ask the question, right? And the long story short is you can use effectively weasel words to
what?
weasel words is what I call it. You can offer someone something you don't have.
Right.
And if they reject that, then you're able to sweep them anyway. So we don't have a place for them to go, right? But assuming that these people are gonna just reject our services outright, as we discussed, right? The more you do this to people, the less likely they are to say yes. You're then able to just keep moving them along. So it's the equivalent. What we're doing with human beings is sweeping some dust under this rug. And then when that pile of dust gets too big and you can see the bulge, you sweep it into the next rug. And then you just keep doing that. That's not a way to actually solve the problem.
Yeah.
And again, I wanna underline, I empathize with all of you strongly, regardless of your political leanings, whatever disagreements we have. We don't want to see people out on the streets. It is a public health hazard, it's unsightly, etc. I want to solve the problem. I don't want us to just push it around.
How many homeless do we have in Aurora?
In Aurora, the estimated chronically unhoused population is close to 600 now.
Yep.
Like
And it's probably
that's,
more.
Oh, I
it's,
thought it was
yeah, the
more.
point in time counts are undercounts. They're
Way
super
under.
unreliable. They're way
It's
under.
only 600?
That's the attitude I want. Only 600. You're absolutely right. Only 600. Denver's is like over 3,000 right now. Houston 8,000, right? If we do this, we can build basically the equivalent of like 6 apartment buildings of permanent supportive housing. That number is 0.
So then do we get them from Denver and Jeffco
So-
and Adams and?
That's part of that's what I've heard like concern around. What we know is that the unhoused population doesn't typically travel that much. They want to stay, just like us, we like to stay in our community, right?
Mm-hmm.
Like well, especially with COVID, I seldom leave my apartment, to be honest with you. But I live in this area. Like Rosie's is my go-to spot in the mornings, right? The Outback, the Roadhouse is where I like to have dinner with my wife when we're early. We want to get that senior discount, And Havana is where I go when, we're feeling a little fancy. We'll go to Sushi Katsu. We were actually just there a couple weeks ago, you know what I'm saying? So this is my area. I don't like to travel to Lakewood or, Denver. I hate going to Denver, to be honest with you.
I do too.
So I avoid it if I can. So the only reason I used to go out there was for work. So it's the same thing for folks who are unhoused. They still form community bonds. They still have that sense of familiarity, right? So no, I don't think that we're going to have suddenly, news is going to get out to the campers in Denver that, oh, Aurora's got free housing for you. Because number one, we're not going to have 3,000 units of free housing, so that's not true. And number two, a lot of people aren't going to want to just uproot what they're doing over there and leave their whole community behind. In fact, I think the opposite's what's going to happen. We're going to basically show up all these other jurisdictions and embarrass them. We always get all the, if I may, we get so much shit talked about us as Aurora,
know.
and it pisses me off.
Yeah, we all hear it.
Because we have an opportunity to actually address this problem and show them up and be like, look, listen, we're going to put politics aside. Y'all know our council's ugly. We have strong disagreements on a lot of things, and I think different ideas of what reality looks like. But if we can push this together, this will embarrass Denver and Centennial and all these other communities that have camping bans and don't actually do anything to solve the problem to do the right thing.
Where
Who's
would
gonna-
you, oh, go ahead, Charlie.
Who's gonna maintain this?
So this is something that would require investment from the city. Commissioner Baker's gone, but we obviously want to partner with Arapahoe County and Adams County. Douglas, again, we have such a small sliver of Douglas, and I honestly don't think that they want to support this anyway, just for ideological reasons. So I think we'd be barking up the wrong tree there. So hit next page real quick. So I think it's a video, right? Yeah. Okay. So this is we'll press play on this in a second. This is actually like a quick overview of what permanent supportive housing is. If y'all haven't already kind of grokked it from my explanation, but what part of what the solution that I'm leading towards here is getting a fact-finding mission basically put into place to go to Houston and to go to San Antonio. Houston, again, for the permanent supportive housing program. San Antonio, because they've done a great job demonstrating what an effective interim step looks like with their, basically they have a massive safe outdoor camping space. Y'all know we have like 2 small ones, right, that serve like 30 people each. They have a huge one, and it's been very successful to stabilize people. There are some folks who, again, their situation is not as dire as the folks that you're talking about, who are addicted, just out of their, I don't want to say out of their mind. Try not to be ableist here, but basically who need a lot of help, right? For the folks who are lower barrier, those safe outdoor spaces, that does the trick for them, right? It lets them stabilize, it lets them find housing, it lets them reconnect with family, because a lot of the times, this stuff is literally comes from I got kicked out of my house because I'm trans. I divorced my husband because he was abusive, and now I'm out on the street. Whatever the case may be. So those things are a little easier to address than I am chronically addicted to a substance, or I have schizophrenia, I have severe untreated depression, whatever the case may be. That you need medical intervention. So it's a lot more intensive. to fix. But that's where permanent supportive housing comes into play. It's for these cases where, or frankly, like you have a disability, right? And you're not a veteran, so you can qualify for veteran services and stuff like that. That's what permanent supportive housing is for. So your answer is who pays for it. The initial capital construction is by far the most expensive part. That's literally building sticks and bricks and getting land. And you know how expensive land is anymore. So that's where we really need intergovernmental partnerships with. The ongoing maintenance of that, I think we could probably fund with marijuana money. With what we're currently using for what I call the patchwork of services, right? That we get people warm blankets, we get them food, we keep them from dying, which is good and important. I don't think any of us want people to literally die on the streets. But as we scale the sticks and bricks up, we can reallocate some of that funding to then staff those buildings. And that's how Providence at the Heights works. So I don't know if y'all have had a chance to go to PATH, and frankly, I don't know if Hassan is letting folks visit PATH yet, because it opened up right before COVID. Like we literally moved the furniture into PATH early January of 2020.
Where's it located?
So it's actually kitty corner to the Aurora Municipal Center. I can see it out my window at City Hall. So it's at the, is it Elevation Church?
Yeah.
It's on their property. So it's south of Alameda and east of Chambers. So.
Okay, that restorative church there at Chambers?
Yeah. So they actually donated land to the Second Chance Center.
That's the one you're talking
No,
about?
Yeah.
that's where
That's a different one?
so she's talking about restoration, which is
Oh no,
where we have the
Restoration
safe-
Christian Fellowship
That's
is where the
Yeah.
safe outdoor parking and safe
Yes.
outdoor camping is at.
An area there, and there's,
Yeah, but
They
these
have
are
a,
separate.
and they actually want to do something similar to what we're
they
discussing
got
as well.
some tents in there now.
Yep.
And they
And-
got
And
the
safe car camping
the
and
laundry
alcohol.
facilities and,
Yes, and part of Pastor Felix's vision before he passed away,
Right.
but that they're committed to fulfilling, is that empty parcel is going to be housing, which I think is amazing. That's part of the YIGBY, the Yes in God's Backyard movement, and I love that so much.
so you're
Because
hoping
we
that
need it.
one of these permanent
Well,
housing solutions will
Could
go
be,
on that
it
property?
could be there because that'll help us tremendously with the land cost. Again, land,
Yeah.
very expensive, huge barrier.
Right.
So, go ahead.
Who's gonna tell them, okay, they move into this nice, new, clean facility. Who's gonna tell them, no, you don't need to bring that lawnmower from the Goodwill
Into your,
and into the
all
apartment?
right, let's press play. So I'll show you how they reach some of these folks. Again, everyone's situation is different, but
Poverty can strike anyone and send them spiraling into homelessness. Teresa is a smart, hardworking mother.
I got diagnosed as having bipolar schizoaffective disorder. It caused me to lose my job, lose my home. I lost my kids. It just destroyed my life.
Teresa is not alone. Many people experiencing homelessness have similar stories.
I'm mentally ill. I'm paranoid schizophrenic. I have a problem with seeing things that aren't there and hearing things that aren't there. So I was homeless for a very long period of time.
To solve an issue as big as chronic homelessness, no organization can do it alone. That is why United Way brings together multiple partners like Arizona Housing Inc., to address these complex issues.
This is a permanent supportive housing apartment building for people that have a history of chronic homelessness. They can shower if they need to go to job interviews. They've got a place to sleep at night. They've got a key to their own unit. They have a safe place. A place to stay isn't enough.
United Way also partners with Community Bridges, a program that surrounds residents with the support services they need to change their lives forever.
We have case management services. We have mental health services. We have emotional support.
There's a sense of community here. We all know each other, and we're all very supportive of each other.
With that extra support, I was encouraged to go to school and get my peer support and do a lot of things.
At United Way, we imagine a community where every individual has an opportunity to succeed, and Maricopa County thrives as a result.
They're a vital part of our partnership, and the whole idea of just having all of these services under one building, they're really important to what we do.
I have education to go further in life. I have a roof over my head. I don't have to worry about where I'm going to sleep. I have a full-time job. It's just a wonderful feeling, being self-sufficient again.
I'm ready for the next step in my life, whatever positive thing that's how helpful this place is. So I'm ready to take the next step, whatever that is.
My mission is to give back. I'm gonna help change the world one household at a time. If I can provide affordable housing for other people so they won't have to experience homelessness like I did, I'm gonna do it.
United, we have the power to lift individuals, families, and neighborhoods to break the cycle of poverty for good.
All right, so that's from Arizona, but I think it's still a good overview of kind of how this kind of programming works. Go ahead.
The lady that was there, she will be successful.
Mhm.
Because she wants to be. That's why I'm saying, you gotta put them in categories.
Yeah, so,
Or the people that say, I've had homeless people tell me, they're walking down the street and they ask you for money, that they can't get a job. There's no, they tell me there's no jobs available. And I'm going, well, everywhere I go, it's help wanted.
yeah.
There's signs everywhere.
And I get that, but at the same time, someone who's homeless, probably on something, who looks disheveled, who smells bad,
You haven't
is-
slept well.
you're not gonna get an interview, much less a job, right? And let's be real, you can, let's say Subway, right? Because I've seen help wanted signs at the Subway over there.
Yeah.
Okay, you get paid $12.32 an hour. You know how much you have to make to get a studio apartment in Aurora? $21 an hour. So remember, we tried to raise the minimum wage, we couldn't do it. That's why, because it's just completely, that's unattainable. So so back to your point, like who's going to pay for this? This isn't like completely free housing. These folks, after they move in, after they are on the path towards getting better, they do pay rent. It's well below market rate rent, and I think that's a great thing because it allows people to actually build up a savings and get stable, you know. And a lot of these places over time are able to support themselves. There will always have some kind of subsidy, but the price that or the amount that we're putting in decreases over time. That's how a good permanent supportive housing model works. And a lot of these folks are able, once they get on medication, once they have therapy and go through their issues and all that, are able to basically reintegrate to society just like you and I, right? But there's a lot of trauma for every unhoused person. Like I cannot imagine what it would be like to live out on the street for that long. My wife grew up homeless when she was a homeless child. Y'all might have heard the story I told at our last council meeting about someone's car being towed and then basically they got separated from their daughter. That was my wife. Her mother's car got towed when they were unhoused, and my wife ended up being separated from her for like 4 years. So, yeah. So when we're sweeping people, that is the hell that we're visiting upon them, on top of everything else that they're going through. And I get that that's very difficult for us to imagine. The closest I've ever been to being unhoused was when my wife and I both lost our jobs on the same Friday. We knew she was losing hers. She worked for AARP. She was about to become the director of student outreach in 2008 for AARP Colorado. So lobby college students and explain to them why Social Security is important, damn it. And I was working as a store designer at Sports Authority at the time. This was back when we lived in Englewood. And we both lost our jobs on the same Friday. And if it were not for the fact that my parents were still together at the time, we would have been out on the street. No one else we knew could take us. So I had to pack up our stuff. I was afraid I was going to lose my girlfriend at the time. And I moved back to Texas, and thankfully she came with me a month later after I was able to land a job designing laboratories in Houston. And then we came back in about a year and a half after Sports Authority called me back. But what I'm saying is I got very lucky there. There's a lot of people who don't have mom and dad to go back to, who don't have anyone else in their life that can let them basically live with them for free for what we got 6 months of basically free living, right? That's what it took because we emptied out our savings to move. So there's a lot of different situations that can lead someone to being homeless. And yeah, eventually, if things had gone differently for me, I might just be coping with the fact that I feel like a complete and total abject failure by taking meth or something. I don't know, because it just makes me feel good and I don't think about anything else. And that's how I cope with the fact that I live outside now, you know? And I don't get to pursue my hobbies anymore. My dream of becoming a bin manager was gone. You know, all of those things. Like, it can devastate somebody. And I have not been in that position, so I can't fully articulate that to you. But these are things I hear from people who work with the unhoused on a daily basis. And we have to be, like, I think, more understanding of how exactly we created this mess that we're all in. None of us want to be in this mess. Again, I'll reiterate, I don't want to see a single person sleeping outside. But this is how we solve it, not by pushing them around until the sun burns out. So, yes?
Well, I have a question, I guess, and a comment. The Road to Work program, and I get their email letters, and I talk to people over there and stuff. Are they not a good model or a good partnership in this thing, because their program,
Road to work. So are we talking about like
I think
the
it's-
Bridge House?
It's Bridge House.
Okay, so yeah, so Bridge House is really, really good for people who are legitimately just down on their luck, like who are able-bodied, sound of mind, sober or willing to get sober. It's a high barrier program, but for those people specifically, it works well. They have about a 60 to 80% graduation rate, and for those of y'all who don't know, like basically they take you in, you have to stay sober, and you have to be willing to work. They'll help train you if you don't have skills. If you have skills, they'll connect you with job placement and all that. And you graduate from the program once you have, what's that?
They have like landscaping
Yeah,
jobs.
yeah,
and
a lot of them
programs.
do stuff for the city. So
They
like,
have to put money in savings.
yes, they have to, part of the graduation is you have to have $10,000 in savings and be able to secure market rate housing for yourself. So it's a great program for the folks who are, what I would say, temporarily down on their luck, right? But for the folks that we're talking about who are like on drugs or have a lot of other, like just a lot of disability, like either physical disabilities or need, therapy and stuff like that, which are gonna be typically the bulk of the visibly homeless population, more needs to be done. It's not just we'll kick you on the butt a couple times and you'll get out.
well, I guess what
Yes.
I'm asking is, perhaps they could partner in how they get people to that point, because,
Yeah, I think there's a natural partnership there for a handoff, right? So like you get someone in a permanent supportive housing, they get that stuff taken care of, these major underlying issues addressed, and then maybe they're well enough to then qualify for the Bridge House program. Is that what you're saying?
well, sort of. I'm just wondering if they would be willing to participate in, maybe brainstorming some stuff around this.
So I think it's important for the foundation, that there's a lot of services that exist in the city. It's not just that program
I know.
and it's not just Kamida. So I think that's really critical in this conversation, is that there's a lot of, that are funded by the city and funded outside and nonprofit. They're always in conversation, and all of them are trained to do like these evaluations that he's talking about.
Yeah.
So there's different levels. It might be like, you just had a car accident and that made you miss rent and you got kicked out, right? That's one level. And just with a little bit of support and as getting you back on your feet, you're back on your feet and you're good, right? And then there's a little bit where you might have been homeless for a while, you might have some underlying issues, and there's tests that all of these social service organizations give the same test, and they're ranking people in categories, like you were talking. So that is happening. I want to be clear. That absolutely is happening. There are professionals that study this and do this. And then there's the third category, which is probably what the majority of community think is homeless, right? What we in our heads think is like, you see the people in Mississippi or, camping, and not everybody has mental health issues. Some do. Not everybody has substance abuse issues. Some do. Most people, a lot of people have trauma.
Yes.
That's for dang sure. And that's the underlying thing. And if you had trauma, and I guarantee you there are people in this room that we have had trauma in our past, right? And there are ways to supersede that with support. And so all of these programs are all talking to each other. They're all known to each other. There's referrals to each other.
Yep.
We are lacking housing, permanent supportive housing. We're lacking funding for more, rental assistance and more social services. There's distinct funding issues that exist. So I think that's really important for this conversation, that
Absolutely.
we do need to say that it's not like, the social services haven't figured out how to test it, right? That is
I
absolutely
understand that,
happening.
because I worked in the probation department for 24 years, so
Yeah.
I understand all of that.
Yeah.
But I guess my experience with clients that we saw was navigating the services. They were overwhelmed. And one of the things I asked the officers in my office to do was to go with one client to apply for food stamps. Just one simple thing. And they were, eyes wide open about how difficult those kinds of things can be, and how humiliating, kind of. But I guess, I know the services are out there. I'm just wondering if people perceive them to be so difficult to navigate that they don't have the skills to see it through.
I think some people do, some people don't. Again, homelessness is not like this monolith, and I think
that's super important in this conversation, is there are, you know, there's so many different things, people have different needs. We also have outreach teams that are going out in vans and bringing socks and food and warm coats and all sorts of stuff, offering them services.
Yep.
We have cold night activations with COTS in our Aurora Day Resource Center. There actually is a ton of stuff. We are doing amazing work, like way more. I've been in the city 7 years. What we were doing 7 years ago and what we're doing now, it's like night and day, even just within the city.
Yeah.
So I think that is critical to this conversation, and it isn't always just a choice. You know, like I hear a lot of people saying they're choosing that. I think it's a choice that with mental health, with potential addiction, with down and out, you know, with lack of opportunity, we have to look at the whole big picture and not just look at it as, would you choose on a freezing cold night like last night, would you choose that? I don't think anyone
I'm
would.
just gonna go sleep under the underpass, I'll see you all later.
But it's because of options too.
Yeah.
Some of them do,
You're not gonna choose to freeze. That's just straight up. You're not gonna actively choose.
They won't go in, some of them.
Okay.
Even as, it can get 30 below.
Yeah.
I'm not saying there's a
And
lot.
But there's other issues that are.
Yeah, exactly, there's other barriers that they have.
Yeah.
And I get, that,
They,
like, again, like.
some are afraid of other people.
Yeah, no, absolutely, and I hear the
Yeah.
frustration in your
Yeah.
voice too, like, it frustrates me as well.
Yeah.
But that's why we need to actually invest in these solutions that
That's
can
what
address
I always
the
say,
full
find
spectrum.
The cause.
Yeah, and you've heard me say that I think a million times on council, address the root causes, because I feel like all we ever do is react. So that's what I'm trying to do with permanent supportive housing, so the next slide. So yeah, I thought I said this was gonna be short, I guess I lied, sorry. So this is Providence at the Heights, for those of you who haven't seen it yet. This is PATH, as it's usually called. This is just after construction. This looks like a luxury apartment building, doesn't it? Yeah.
It's beautiful.
Yeah, and I actually helped move in the furniture to this, and like, these are 1 and 2 bedroom units. I would gladly live there if I qualified. Like, they're great.
Where's this at,
So
Juan?
again, this is at, right behind Elevation Church, so Alameda.
Chambers in Alameda.
Chambers.
I meant the
Oh, sorry.
building.
Okay.
Yeah, that's what we're
Yeah.
saying. That's what we're telling you.
It's right, see the address right here,
Chambers in Alameda.
15650 East Alameda.
So the city building's here, and there's that strip mall right there, and it's behind that strip mall.
Yeah.
So
Like I said,
this is the
come
only-
see me at City Hall, and you can look out my window and see the building, so.
So it's catty corner, it's on the, what would that be, the south?
On the south
east-
side,
Southeast
southeast, yeah, the southeast,
corner of
corner.
Chambers, but behind the strip mall.
Right behind the strip mall.
What incentive do they have to make it, you know, so they don't destroy the units?
So they have, so this whole area that you see down here, and there's actually some more units back over this way. These are all offices for like clinicians, you know, they have a detox service, they have a barber shop and all kinds of other stuff in this facility. So it's a full service, so yes, go ahead, Chance.
Would you be open to having one of your meetings at elevation so that they can see or see where it's located at?
If,
Like a mini field trip, because I know a lot of people always ask, but you're right, it hasn't been really open to.
to
we're
the
not having a
public,
meeting
yeah,
there,
like I know
it's
that,
elevation.
yeah, I know that Hassan wanted to do, Hassan Latif is he's the head of the Second Chance Center, and Second Chance Center is the organization that built this.
Oh.
And he wanted to do a community open house to invite everybody in, and then we had COVID.
And then COVID.
So, yeah. Like I said, like we were in January out here in the snow, there's pictures of us like moving in all the furniture that was donated for this place. It's a beautiful facility. And there's,
Where is it at now? Nobody's living in it?
oh no, 50 people, 50 families are living in there. So,
Oh.
but that's the thing, they have 50 units of housing.
Like a year, 2 years ago, right?
Yeah,
So
like-
it's been functioning for 2 years
Yeah.
now.
And it's been quiet, you wouldn't know that it's there. It's, you know, that's how these work when they're well
But you didn't
run.
answer my question.
So, what's the incentive for
To
that?
make it so they don't, you
So-
know,
Again, like they have all of these services here, and they work very closely with the folks, especially when they're getting onboarded and moved in. I don't work in permanent supportive housing, but that's my understanding of how the process works. It's not quite like a screening, but it's like a very intensive, like, hug almost, if you will. Like they'll help you acclimate into getting off the streets. Some of these folks are not just homeless, but some of them are re-entering from the criminal legal system as well. So they have literally nothing else, right? They'd be on the street if it weren't for this.
And there's probably like community agreements and stuff
Yeah.
like that, and there's classes and supportive
Yeah.
stuff and counseling.
Yeah, and again, like I'd actually love to see if Hassan is willing to have people come in here. Again, like this is like, there's people who live here now, but if we can set up a, you know, board meeting trip to go see that, I'd love to do that.
So that's gonna be the model for what you wanna do?
So this is a model.
A model.
Yeah, again, like we talked about earlier, not one size, this is not one size fits all.
Yeah.
And you have these different categories of people with different levels of need, right? But we need more stuff like this. We basically need 10 more paths to address the unhoused population that we have today, roughly 10 more paths.
And how long can they stay there?
They can stay here forever. And like, again, these are below market rate apartments. So these folks, the folks who live here do pay something.
The
Whether it's
entire
through disability,
apartment is-
whether they have a part-time job, yes.
Mhm.
None of this is completely free to people. So it is much lower than market rate, which I think everybody should have, quite frankly, but.
Who paid to build it in the first place?
So this was done through the Second Chance Center. They had their own funding, a lot of philanthropic grants, and I think the city kicked in $2.5 million of gap funding through which is what we normally get money through HUD, which Jason, he's on the, it's just Jason Snyder, Ward 4 resident, and he's also on the, God, I'm gonna butcher the name, the Citizens Housing Commission, right?
Yeah, it's a Citizens Advisory Committee for Housing and Community Development. It's a
Yeah.
mouthful.
Yeah. But so whenever we get, things that come to council around, funding through HUD dollars to address homelessness and affordable housing, he sees it all before we do, because it goes through the committee.
And all housing has AMI, so I think, so that's the area median income. And so things will be ranked at 30%, 60%, 80%, and what that area median income is basically like, in this area, what it would cost to rent an apartment. And then they look at your income and they see how much you make. And so we need a mixture of these 80s, these 60s, these 40s, these 20s, because not everybody needs, again, not one size fits all. They need a mixture, and we need to have different options that help support people. So different housing projects have different, and sometimes buildings have different area median incomes in the same building.
And PATH, if memory serves, it's been, 3.5, almost 4 years since we were before council lobbying for this to happen. This was before I got elected. I think PATH is 30%, which is an area that is grossly underserved. That's like people who are like your fast food workers, basically, right? That's the kind of support that they would need.
Okay, so somebody moves in there and they decide they're not gonna keep it clean, they're gonna do their pot in there, whatever, their drugs. What happens to them?
That is a great question, and again, my understanding, and this is why I think we should definitely do a field trip and talk to Hassan and, to the staff there.
Okay.
They have, covenants basically, like you would have in an HOA, right?
Yes.
Because you can think of it like it's if it's a condo, right? It's apartments, but if it's like a condo, and you have to abide by those covenants. If you don't, I don't think that they're ever gonna, especially not knowing Hassan, they're never gonna just kick someone out into the street. They'll probably try to find another program that's better suited for them to deal with whatever they have going on that makes it so that they're behaving this way. But yeah, because obviously they want to keep the place safe, clean, habitable. So yeah.
Okay. So like if you had, say, families that.
And yeah, these are 1 and 2 bedroom units, but yeah, you do have small families that live here as well. So.
Are there not any vacant buildings in Aurora that can be converted?
Currently vacant? No. Buildings that are trending in that direction? I think so. There's plenty in Ward 4, frankly. We have a lot of aging office space that literally, you'll have a 3 or 4 story building with 1 or 2 tenants. Congressman Crow's office is actually one of those buildings right now. I think it's literally just the congressman's office, and then the U.S. Postal Service has something on the 2nd floor.
The rest of it's empty?
I think so. It's like a ghost town. The parking lot's always empty, but I think that there's opportunities like that, for sure. So yeah, this is PATH. So next time you're out and about near City Hall, just swing by and take a look at it so you can see the beautiful landscaping and all that and how they actually got that facility. And then there's another issue that I wanted to touch on. And I love this topic and I'm happy to talk more about it. I just want to respect y'all's time. I think we're getting close to 9 o'clock. So towing reforms is the second one. So I actually heard from several Ward 4 residents who unfortunately had their vehicles either broken into or stolen and ended up getting towed. Some of them were, again, the victims of motor vehicle theft. So I reached into APD and city staff to see what's going on, because the big complaint I got was, listen, I got my car stolen. I wasn't able to go to work for 3 or 4 days until they found it and it was recovered. And then I have to pay $300 or $400 in fees to get my car back. I haven't been able to work in almost a week, and I don't have the money in savings to get my car out. So now I'm SOL. So I think that that's exceptionally unfair. It's insult to injury, right? I don't feel like we should be, charging people to get their property back after they were victimized. So I reached into the Aurora Police Department. They agreed. And it turns out there are things that we already do to the maximum extent that we're allowed to do by law to kind of lessen that pain. So I think I have that information on the next slide. So basically, if you ever have your vehicle impounded, there is a $36.25